So we're here at Remote Area Medical at the Oakland Coliseum in Oakland, California. This is the incredible organization that sets up these medical tents. They usually do it, gosh, they set them up in 14 hours. There's so much here. All of the equipment. There's probably about, 200 dental chairs. And they're here for 4 days. I'm here on a Monday. They've been here since Saturday, and they've seen about 2,400 patients so far. They said that 90% of the patients come here for dental and vision because in most health insurance policies, you barely get dental and vision. And this was not even part of the so-called debate on healthcare reform that we had a few years ago. And notice how we don't really talk about this much anymore in the U.S. But clearly, as you can see, there's so much need. I just met a young girl who said that she stopped smiling at school because she had yellow spots on her teeth. She was about 9. And after the dentist took off the spots, she couldn't stop smiling. The people that I've spoken to so far said that they're seeing patients from every background you can imagine. A lot of people have lost their jobs, and they just don't have the money to afford basic health care. I mean, we're talking basic health care. What's incredible also about this remote area medical is it's immediate care. So you come in with a problem and you leave and it's fixed. Another woman I recently interviewed said what she loved about it is that there's no judgment. She said that everybody's treated with dignity and respect, and everyone's so friendly and helpful. And she said that was very refreshing. So I'm here, what is it, about 4:30. A lot of the dentists have left for the day. Most of the... It's okay. Most of the people who volunteer here, well, now that it's a Monday, they go to their practice during the day and then maybe get off at noon and come and work for a couple more hours. But Stan Brock said that if we get rid of the barriers that don't allow doctors from other states to cross state lines, there would be more volunteers and more patients would be served. Actually, I just met a hygienist who drove down from Washington State. She read about it and said she wanted to be here to help. I mean, that's the kind of people that you see at this place. So we're still in the dental area, and it just goes on and on and on. It's really amazing. And Stan Brock earlier told me that he really wanted to emphasize the importance of the volunteers because this wouldn't happen without them.
Thank you very much.
All the equipment. And then here we've got all the trays and the equipment. Oh, and then they must be sterilizing them here. Are you doing all of the sterilizing here?
Yes. It gets washed, it gets oiled, and then it gets sterilized. It's all the 3 steps. Dennis will tell you all about it.
Okay, thank you. Hi, Dennis.
Hello.
I'm a reporter with KALW Radio.
Oh, are you Holly?
No, she's my colleague.
Is she?
Yes,
What's your name?
Rose Aguilar.
Oh yeah, I listen to your show all the time.
Well, I'm
what's the
your
name?
call.
Yeah, your call.
I'm doing some video just to let people know what it's like here. This is an amazing operation.
Isn't it too much? Yeah.
Yes. So you're Dennis Ring and you're volunteering.
I am.
So what's your experience been like so far?
Well, it's been pretty positive, but I just found out I got to open again tomorrow, so that'll be my 3rd day.
Okay.
4:30 in the morning.
Wow.
Be here. Then we start serving people at 5:30. But that's okay. I'm not complaining. It's just been a long.
Oh, I'm sure.
Yeah.
Oh, the volunteers are incredible.
Yeah. Thanks. Good.
So,
I love your show.
Is this what you expected?
Yeah, because I had some history of what was going on. This is my first time with RAM,
Okay.
but I felt that this was. I knew what the volume that they do,
Right.
and what they did in LA. They did 8 days in LA. They did 8 days in New Orleans in a tent at 45 degrees or 50 degrees. Without this setup here. I mean, this is beautiful.
Oh, it's cool. It's incredible.
Oh, that's cool.
Yeah. So the trays, the sterilization, because 90% of the patients come here for dental and
Right.
vision.
Yeah, and vision.
Right.
Absolutely. So there's a lot of Chinese medicine that's happening here as well. So those people are pretty cool. Yeah. Good.
Immediate care.
Pardon me?
That's the other thing
That's
that's
what it
amazing,
is.
it's
Yeah, you
immediate
would
care.
think, but it's kind of died off a little bit. But yeah, no, we had a pretty big rush today, don't you think?
I think so.
Yeah.
It's like a big, it's like a thing going down a snake, right? The bottleneck just moves throughout the building.
Right.
Yeah,
Absolutely.
And what is your name?
I'm Paul Congdon. I'm the husband of Pam, who's the one that.
Oh, yes.
did everything.
I interviewed her earlier.
Sister-in-law, Patty.
Yeah, and Patty's my
So,
sister.
and so what are you doing here?
I just do a little bit of everything.
Okay. And what's your experience been like?
That's been fantastic. Yeah, it's been fantastic. Just amazing. I mean, they haven't seen so many people getting so much help. It's awesome.
What's amazing, too, is we need a clinic like this to stay.
Yeah.
And there would be so much, there's
Yeah.
so much need.
You'd burn through some volunteers, though. We need to we got to refresh those people.
Well, that's true.
They're doing a ton of work.
Oh, yeah. Well, thank you for what you do. Thank you. Thank you, Dennis.
Yeah, great. What's your show on Friday? It's
The Media Roundtable.
Yeah, there you go.
Yeah.
All right.
Thank you.
Thanks, Rose.
Really incredible. There's the work. They're doing hardcore drilling here. I just got drilled today, actually, at a dentist, and it's amazing that they're able to do all of this work right here. Drilling a little bit. Excuse me? So, there you have it, in the wealthiest country in the world. 4-day free clinic, serving people, some of whom haven't been to a dentist in 20 years. And we'll go over to the Vision Center next.